everybody. Thank you for joining us this morning. And the reason why you're here is that we are actually celebrating 50 years of Uday Clinic and now Udai Omni Hospital. So many of you might have heard of the old Handika Dawakhana, the old Uday Clinic, which used to be just across the road here. And when we joined hands with the Omni Hospitals, we have expanded into this modern facility with 150 beds, and now we are multi-speciality. We used to be purely orthopedics. Now we are a multi-speciality hospital. But orthopedics is still our backbone. We still do a lot of, essentially, majority of our work is orthopedics and specialty orthopedics. So we do everything from pediatric orthopedic work to deformity corrections to trauma to broken bones to spine surgery, tumor surgery, joint replacement surgery, you name it, anything in orthopedics, we do it at a world-class level because we have experts who have trained abroad, who've got huge experience in their specialty and subspecialty. Gone are those days when an orthopedic surgeon was the answer for any bone problem. Now we have super specialists specializing in every bit of orthopedics. And the journey of the clinic has been glorious. From the start, 1974, when Dr.Ved Prakash basically came up with a concept of starting a private hospital because he was not happy with what he was seeing when he came back from the UK. Very poor service to our people. And this is where excellence began. He had to innovate a lot of things to treat local problems because we didn't have the facility or the materials to fix the problems that people had. So we had to innovate a lot of surgeries, and that's how it started. The story started and moved on. He had many doctors along the way to help him, and I will actually stop here because I think it's very important that Dr. Ved Prakash says a few words about how we started and where it all ends. We'll end with Dr. Raghava.
I just want to know not only the public of Hyderabad, but also the medical community that we stand for patient care, not using our hospital as a medium for earning money. Of course, money flows behind the talent. Doesn't matter what kind of talent there is. And that was in mind when I thought that I must venture into a private orthopedic venture. And then this orthopedic venture was as a service to Hyderabad public, which they never knew before. Never knew before. The only source of orthopedic treatment, fractures and orthopedic diseases and deformities and tumors, was government hospital. And as you know, whatever the government hospitals do, there is never a personal touch. And, forget about the compassion and the amount of care they can afford to give to patients in huge numbers. And there was no other way but a patient to go to government hospital. And orthopedic treatment was done only in government hospitals. And when I saw that, I thought that it is necessary for us to start a private venture. That's how a very small hospital was started in the bylanes of King Koti Road. And it was named after my father, who was a very popular advocate and a public worker. Not only public worker, was a leader of the public in Arya Samaj. And then he inculcated in us, right from beginning, a sense of service to society. And I always felt that when I was working in England, people were so very well served by the national health that let one day be India on that level. So that was the aim of starting the institution. And that was in 1974. And then, of course, it started as a means of living and in a very small scale. But then it progressed because of the immediate popularity which our small hospital gained at that time. And this popularity was because people were really waiting for a nice private orthopedic hospital to be built where things were personal. Till then, even though orthopedics was done by Nizam's Trust Hospital, but people were not satisfied because the treatment was not modern. The Nizam Orthopedic Hospital never treated trauma, but they treated spoiled trauma, which was a great gain for me when I joined initially after returning in 1967. And for 6 years I worked there, from 68 to 74. But I soon realized that things are not up to my liking. And then I ventured this. And I was not sure that we will succeed, but the hospital became popular. And then the house owner, where it was started in a rented building, became jealous about seeing all the rush. And then I thought that my patient deserved a better service, so that's why we started a hospital just behind this uh, multi-speciality hospital, and then soon realized that the corporate hospitals are gaining popularity, and my friends advised me that I should uh, start a corporate structure, a bigger hospital with many specialists, because orthopedics as a single specialty is always connected with every part of the body from head to toe. And then this dream was soon realized because of my young doctors joining me, getting training. Some of them stuck to us, some of them started their own institution on the strength of knowledge they got and the technology they got. So that's how this great, I would say, bigger hospital was built. And I wanted it to be a boutique hospital where uh, all kinds of specialists will be there and give service to the society with joy and expertise. That's how Udai Omni came into existence. My son-in-law joined first before his marriage, uh, after his MS, and then others came. So that's how this hospital has come about in a matter of 50 years. It's a grace of God, and my teacher teachers of every level, from high school to my post-graduation, who at that time attended the inauguration of the last hospital. This was in 1983. And then that led to the encouragement. And for a couple of decades, there was no other hospital which gave private orthopedic service excepting mine. And thank you for recording all this. If there is any... Huh?
Dr. Prakash,
Huh.
let us just ask one question. How young are you?
Well, that's a There's no secret about it. I was born in 1933, September 25th.
91.
91 years.
I think, and the good thing is he still spends time seeing patients about 2 hours a day. He's got so much to do during the day. His day is packed with activity, from meditation to yoga to meeting people through the day to seeing patients. Again, the evening starts with cleaning and so many.
I was not telling about my contribution, but my contribution presently is to treat people's lifestyle disorders, not diseases. And these disorders are huge. Things like osteoarthritis, things like spondylosis for the lumbar spine and cervical spine. This is a technical word. It is pain in the neck and upper arm. Nowadays we have got this mobile, and because of that they get pain in the neck. So it's a small contribution to what is going on in this hospital. That's it. But there is a limitation. One can do.
Hospitals on this earth are single units. The Royal National Orthopedic Hospital, the greatest orthopedic hospital in the whole of Europe and the world, is one hospital. Mayo Clinic, Campbell Clinic. So it is always good to have a world-class center than expand everywhere, dilute the quality. So by building hospitals, buildings can be made, equipment can be bought, but you cannot get quality doctors. So at the moment, we will certainly expand this hospital. Maybe we will have a few outpatient outlets, but this will be the center of excellence, which it has been for the last 50 years. This hospital has 3 revolutions. The first revolution took place when Dr.Ved Prakash started. There were no trauma surgeons in the country. Forget about our combined Telugu states. No trauma centers. This was the trauma center. People, I remember coming from Assam, Meghalaya, Northeast, Punjab, South Kerala, coming to our hospital for fracture treatment. Apart from, of course, Afghanistan, Dubai. So we started this hospital as a major fracture hospital. And there was nothing called pediatric orthopedics. Babies, deformities, their correction of their deformities, hip problems, all that at world-class treatment was done, which was unthinkable in the rest of the country. And all this went without advertisements. It was a silent revolution. The second revolution took place from 94, and I'm so glad that I was the first fully trained spine surgeon of the combined state of Andhra Pradesh and Telangana, and the first few handful of spine surgeons who have come from abroad, and we started the spine revolution. From hundreds and hundreds of babies' spines to adult spines, thousands of them over the last 3 decades, with surgeries unparalleled, with results no less than the best centers, if not better than them, in this small hospital we have given. దీన్ని మేము spine revolution అంటాం. We have published papers in the best journals of the world. This hospital, it looks small for you perhaps compared to the big hospitals. This hospital is today in collaboration with IITs. Today we are in collaboration with our IIIT, T-Hub, and we got a big international basic spine research award, which is unthinkable. So not only treating patients, it is a center for excellence in research into various branches of orthopedics. So now we are also in the process of developing robotic calipers, exoskeleton center, robotic exoskeletons with an IIT. I can't give the names. And
Expand on what exoskeleton.
so people, now you know that in our own state, our own country, construction workers fall from heights. We have a huge accident rate in our country. మీరు అందరు రాస్తున్నారు పేపర్స్లో.
Lack of health and safety.
And we have a lot of toddy workers who climb our trees and fall from heights and they get paralyzed. Once, and most of these accident victims, most of these toddy workers and industrial workers are young people. That means if one person is paralyzed, livelihood is gone. And there are 3-4 family members to look after this paraplegic and more. So now the exoskeleton అంటే ఇది తొడుక్కుంటే కంప్యూటర్స్ ద్వారా అతను నడవగలుగుతాడు. అమ్మా ఎగ్జోస్కెలిటన్ అంటే రోబోటిక్ ఎగ్జోస్కెలిటన్. ఇప్పుడు దీని ధర ₹1,00,00,000 ఉన్నది మన దేశంలో. బయట దేశం నుంచి వస్తే ₹1,00,00,000 నుంచి ₹1,60,00,000 ఉన్నది. దీన్ని 10-15 లక్షల రూపాయల్లో తయారు చేద్దామని ఒక సంకల్పం, ఈ ప్రాజెక్ట్ స్టార్ట్ చేశాం. మీరందరు వినే ఉంటారు, లోవర్ బ్యాక్ పెయిన్లో డిస్క్ ప్రాబ్లమ్స్ అందరికీ వస్తుంటాయి కామన్గా. ఇది ఎందుకు వస్తుంది అన్నది ఇప్పుడు ఐఐటితోనే ఒక రీసెర్చ్లో ఉన్నాం. ఇది త్వరలో పబ్లిష్ కూడా అవుతున్నది. అదేవిధంగా IIIT అక్కడ ప్రొఫెసర్స్తోని రీసెర్చ్లో ఉండి, ఇప్పుడే చెప్పాను మీకు రీసెర్చ్ గ్రాంట్ వచ్చిందని, మాకు ఇంటర్నేషనల్ గ్రాంట్ ఫ్రమ్ ఏవో స్పైన్ ఆఫ్ ద వరల్డ్. ఫస్ట్ amongst the very few hospitals in the country, only 2 or 3 hospitals in the country got that sort of award. No corporate hospital of this country. We can't reveal the details, but it's in lakhs of rupees.
No, but when is this going to be out? Is there any hope?
We have already done half the research. This is on how people are getting stiff, sitting in offices, sitting in banks, and now we are measuring their movement so that once we do the treatments, explain to them non-operative methods, for example, yoga, swimming, sports, how their flexibility is getting affected. Now we can monitor with external cameras. This is all with help from the professors from IIIT, Hyderabad. Now we are going to start sending patients there. Now we are on the process of appealing to the ethics committee there to help us with these programs. So
this robotic exoskeleton, will it be some hope for the paralytic as well?
for paralytics, now as I said, the current hope is putting gadgets in the spinal cord above the damage and making them walk. So those gadgets are available in Hyderabad. And also these robotic calipers where people can wear and get out of the house without help from the family. They can go to work, they can start small businesses, and if the government helps our footpaths and if the malls and the lifts and offices are made physically handicapped friendly or disabled friendly, then they can go out
So
with
at
this.
what stage does this paralytic patient can make use of this?
Whenever they are paralyzed,
No, I mean, what is the percentage of paralysis that can help these patients?
complete paralysis can be helped. Now with the world technology, hands should be okay. If the hands are okay, reasonable power unte hands la, they can use these calipers.
This is with the help of exoskeleton.
Robotic calipers or robotic exoskeleton setup. EXO skeleton. Robotic exoskeletons.
It's a caliper.
It is a caliper.
Doctor, मैं फिल्म सलीम हिंदी मिलाप से हूँ.
Sir.
आपके दोस्त विवेक जी के पास है. फिर प्रकाश जी.
अभी थर्ड मैं बोलने के बाद फिर एक क्वेश्चन पूछ. ये थर्ड रिवॉल्यूशन, तो अभी हम हजारों बच्चों को, बूढ़ों को, यंगस्टर्स को with the most modern technology, with advanced microscopes, image intensifiers, spinal cord monitorings, it's like a Boeing plane cockpit. वैसा हमारे पास equipment है, and all this we are doing at 1/3 of the cost compared to the big hospitals, what it costs.
This operated 1/3 of the cost.
Spine revolution is doing spine work in our hospital. Spine surgeries, as Madam has said, without operating, treating patients, 90% of our patients with spine problems, we don't operate. We treat them without operations. As our chairman, Dr.Ved Prakash has said, we give tremendous advice on their knees, their backs, their joints to get better without surgeries. We have a fantastic physiotherapy department here, advanced physiotherapies with lasers, which is again missing from major hospitals of Hyderabad. All this we do here for their well-being in the hospital. We have back school. That means on a given day, our experienced spine physios teach exercises to patients with back problems. This is our second revolution. Now I want to talk about third revolution. That is Dr. Uday Prakash. This revolution, you must have heard about total knee replacements. He is the better person to talk, but we see that unnecessarily the whole knee is replaced when only part of the knee should be replaced. That's going on. You are seeing the advertisements. And this silent revolution of Dr. Uday Prakash has resulted in a much simpler operation with excellent results. And I request Dr. Uday Prakash to talk about this joint revolution that you may not have heard of. And I want this to go to the public at large.
The third revolution. So before that, you asked about conservative management. Why are people doing too many knee replacements? And that is so true. I'm getting my friends, my patients coming from various hospitals, having been to various hospitals, saying, "Sir, I've been advised a knee replacement surgery. And when I look at the x-rays, I don't see a problem with their knees. And even if they have a little bit of arthritis, they don't need a knee replacement. It has become a fashion to offer knee replacement surgery. And one must realize that it is big surgery. And there are many complications that can happen with knee replacement surgery. And it is being offered to everybody that walks in with a knee pain, with a little bit of arthritis. And I think the public should know that you should just blindly accept any opinion that tells you that you need a knee replacement surgery. I was a consultant in the UK for 10 years and an associate professor of orthopedic surgery. The way the National Health Service brings you up, because all my training was in England, the way they bring you up is that you do not do unnecessary surgery and you do not become a burden on the National Health Service. A good surgeon is one who knows when not to operate. A good surgeon is not one who knows how to operate, how skillful he is. A good patient-doctor relationship is so important to get a good result. So, as you know, there are many surgeries that are happening in Hyderabad where the patient doesn't know who the surgeon is. Here, the way we treat our patients, they're like guests. We build up a rapport. We don't offer surgery as a first resort. We give them many options to get better on their own, allow nature to heal their problems. Surgery is the last resort. And so, why have we been successful over the last 50 years? And why are we doing more and more joint replacement surgery? It's just because of this approach. To heal the patient before, to get to know the patient, build a rapport with the patient, and offer surgery only if necessary. And that has given the trust not only from Hyderabad, Secunderabad, the surrounding states, but we are getting patients from Africa in huge numbers. Because we operate on their joints, on their trauma, on their bullet wounds, on their war wounds, in such a way that the results are so good, they're actually recommending patients in Africa to come to our hospital, and they come with our name on their lips. They only want to come to Udai Omni Hospital. And so they come here to get better. Now, what have we done in joint replacements? Since 2003, when I used to come as a young consultant, we did surgeries that were not done here before. Very, very complex joint replacement surgeries where other surgeries have failed. There used to be fractures of the pelvis that have failed. We reconstructed joints because slowly the international companies who are offering joints, prosthetic joints, were coming to India. They were being made available in Hyderabad, and we did some of the most difficult surgeries. And my father used to keep a cluster of this difficult joint replacements. There was nothing easy in those days. People were given knee replacements when their knees were highly deformed. Now they get knee replacements for pain in the knee, which is ridiculous, really. So we started doing very difficult joint replacement surgeries. We, to a level where we had doctors coming from the UK to witness us do joint replacement surgery here. I had many colleagues who used to come with me, spend time here, and watch and help do difficult joint replacement surgeries. We now, as Dr. Raghav said, we are very conservative in our approach, and if they do need a knee replacement, we see whether they actually need a full knee replacement or not. We offer partial knee replacements. That's only 1/3 of the knee joint is being resurfaced. That's it. And 40% of patients who get knee replacements outside actually don't need full knee replacements. 40%. So imagine how many lakhs of operations are being done which are totally unnecessary. So we do partial replacements where only a small amount of knee is resurfaced with a metal and a bit of plastic, and they can run after that. President George W. Bush Jr., cricketers, sportsmen, there are many people who are running on partial knee replacements. They can go up and down stairs, run up and down stairs, sit on the floor, do their namaz, do their puja with partial replacements because it behaves like a normal knee, like a natural knee. So this is what we do here. Apart from that, lots of complex revision surgeries. Now, what's happening is, I think staff and press should know and the public should know, there are many operations that are not working out for patients. They fail early. They get infections. They have sold farms and houses to get their knee replacement surgery done, then they fail. Now, where will they get the money from to get that repaired? So we specialize in revision joint surgery, where joint replacements have failed, and we put new ones in them. Unfortunately, these cost money. And India is not in a position to offer made in India joint replacements yet for these difficult scenarios. We have to get implants from America, the UK, Europe, and these cost money. So revision joint surgery, revision hip replacement, revision knee replacement surgery is what we excel in. And we have trained many doctors to do this surgery. So ultimately, I will say that this is a complete hospital which does everything in orthopedics that I've mentioned before. And the question about expansion, I will end with that. Like Dr. Raghav said, we have no plans to expand the mothership. This is the mothership. We concentrate our experience so that the patient gets the best treatment. The way we expand is by training doctors to our level of expertise and empathy so that they can go back to their communities and practice the highest standards of medicine and surgical care. This is what we excel in. This is our expansion. This is our network.
When I was the president of the Association of Spine Surgeons of India, we have started training programs in 2-tier cities. That means all the big spine surgeons are concentrated only in the big cities. So there are now a group of almost 300 to 400 excellent spine surgeons across our country, from north to south to east to west, right up to Srinagar. We are training these doctors and they are doing work no less than the best hospitals of the world. And that is being done in India. So Indian spine surgery has reached great heights, and we also run a campaign called Safe Spine Surgery. We educate people about that they should not worry too much about the dangers of spine surgery. As Dr. Uday Prakash has said, every surgery is dangerous. It has to be planned well. It has to be done well. The surgeon needs experience. And also the patient should follow what the doctors say after surgeries for good results. So yes, spinal fusions we do from small babies onwards to any age. The oldest person to get operated at Udai Omni was 90 years old, which is a rarity
In spine.
in spine, just done a few weeks ago. But in the mid 80s, we have done hundreds of these operations in this hospital. So it's become very safe. But of course, the surgeon, as you just said, is it necessary? Is it going to benefit my patient? And am I doing the right thing for my patient? This is extremely important for the surgeon to decide, and we should have a good engagement with the patient and the family, explain what we are doing, explain the complications, and then educate the patient. And then, if you do surgeries, you get a good result. And you need backup. You need backup of advanced technology, the navigation systems, the microscopes, and you must have seen in the ICUs and movies what we call spinal cord monitoring. As we are operating, there is a machine which tells us if there is something wrong, patient about to be paralyzed or whatever, we see on these computers. So all this is necessary. You cannot do these surgeries, and this requires expertise. It is like giving a Rafale jet to a car driver. It cannot happen. So the spine surgeon, just because the hospital supplies the equipment, whether it is spine surgery or joint replacement surgery, you're all hearing about robotics, the cameras, the laparoscopes, the endoscopes, the man behind his knowledge, his training, his experience, his academics, his research. This is extremely important. And that is why for last 30 years, whenever I spoke, whether I wrote in papers, in newspapers, more than 30 years ago, I spoke to media, please take a second opinion. Doctors are not gods. We are also like you. So please take a second opinion. There's nothing wrong. And it's not doctor shopping. It's the fundamental right.
Talk about why we haven't done anything knowingly.
Yeah. As I said yesterday, there was a speech. Udai Omni, there are hospitals, there are good doctors everywhere. We are not the only one. But nobody can beat us. Nobody can surpass us. Nobody can be more ethical than us. They can only equal us. In the 50 years of this hospital, knowingly, we have never done an operation for money, for financial gain. प्रति ऑपरेशन, हर ऑपरेशन पेशेंट के अच्छे के लिए किए हैं. हम भी इंसान हैं, लेकिन किसी भी पेशेंट को हम पैसों के लिए 50 साल में नहीं किए. मैं नहीं किया, हमारे सीनियर डॉक्टर्स डॉक्टर उदय प्रकाश नहीं किए, और ये हॉस्पिटल के फिजिशियंस, अदर स्पेशलिस्ट कभी भी kept patient interest, the most ethical hospital. And what is our corporate social responsibility? Just day before yesterday, I was addressing 2,000 students, college students, extremely poor students, children of very low middle income groups. And these children, they're college students, we have promised on behalf of Udai Omni, these 2,000 students, if they have got to suffer from any, unfortunately, any medical problem, they will be offered free service here in this hospital. I have promised that. And Mother Se Alia, which is just, you can see from here, I'm a student of that school. Whatever I am today is because of that school. And all the children of those school, we have offered free treatment here, whatever it costs. Likewise, we have treated children, adults from poor families. We give concessions, we help. This is a private hospital. We have never turned away a patient for lack of money, to my knowledge. That is the greatness of this hospital.
जिंदगी में पैसे तो सब कमाते हैं, बेगर से लेके बिजनेसमैन, हाईएस्ट बिगेस्ट बिजनेसमैन और सब कमाते हैं, मगर ये जिंदगी का एम नहीं होना चाहिए. और बिकॉज ये जो कहते हैं वर्ड ऑफ माउथ, एक से दूसरे सुन करके इस शहर में लोग आना शुरू हुए पहले बार मेरे छोटे दवाखाने में, जहाँ पे बहुत कम बेड थे, और अब न सिर्फ पूरे कंट्री से आते हैं पूछने के लिए हमको ऑपरेशन की जरूरत है या नहीं, बाहर के कंट्री से आते हैं, अमेरिका, यूके से, जो भी जानते हैं कि उदय क्लिनिक काम करता है, अफ्रीका से लोग, जहाँ पे भी इंडियंस है वो लोग वहां से रेफर करते हैं। डॉक्टर साहब से पूछो, अगर वो कहते हैं कि ऑपरेशन कराओ तो कर लो। तो ये दवाखाना ये रेपुटेशन पैदा किया है, और ये बहुत आसानी से नहीं हो सकता जब तक कि आप प्रैक्टिकली अपने आप को इन टेम्पटेशन से नहीं बचा सकते। यू हैव गॉट टू से मनी फ्लोज आफ्टर टैलेंट। पैसा अच्छे डॉक्टर के पीछे भागता है, डॉक्टर को भागने की जरूरत नहीं है, याद रखिए।
ये पुराने ख्यालात से हटना चाहिए कि नेक्स्ट जनरेशन चलाएगा आपके, मतलब इसीलिए बिजनेसमैन और पहले के राजाएं, उनको एक बेटा चाहिए। मेरे पास बेटे नहीं है, और बेटी बेटी भी है, वो डॉक्टर है, लेकिन वो यहाँ पर आकर काम करेगी ये भी कुछ जरूरत नहीं है। ये हॉस्पिटल का जो प्रिंसिपल्स है वो लेकर हमारे फ्यूचर डॉक्टर्स जो यहाँ पर काम करेंगे, वो लोग यही प्रिंसिपल्स लेकर यही नाम रखेंगे हमारे डॉक्टर वेद प्रकाश का और हमारे लेगेसी का। तो यही हमारी इच्छा है कि जो भी ट्रेन होते हैं यहाँ पर, अगर यहाँ पर रुकने वाले हैं तो हमारे ही प्रिंसिपल्स पर चलेंगे, और अगर यहाँ से ट्रेन होकर कहीं और काम करेंगे तो वो ही प्रिंसिपल्स वहां पर ले जाएंगे। यही मैं कह रहा था कि दिस इज आवर एक्सपेंशन। तो वो प्रिंसिपल्स गाइडर्स, वो हमको नींद देते हैं, अच्छी सी नींद देते हैं। दैट इज वेरी इंपॉर्टेंट फॉर ए ह्यूमन बीइंग। नोइंगली वी डोंट हार्म पीपल, तो उसी से हमको नींद आती है।
एक और चीज मैं बोलना चाहता हूँ, जो लोग लाइफस्टाइल डिसीजेस के अंदर या लाइफस्टाइल डिसऑर्डर्स के अंदर सफर करते हैं, वो है मॉडर्न यूज ऑफ इंफॉर्मेशन टेक्नोलॉजी, that is computers and mobiles. You know, in seconds you know what is happening in any part of the world, but then unnecessary knowledge, यानी जो जो इल्म की जरूरत नहीं है वैसा इल्म आप गैर जरूरी तौर पे मोबाइल्स में देखते हैं। लिखने वाले जो स्टूडेंट्स रहते हैं झुक के लिखते हैं और योगिक एक्सरसाइजेस नहीं करते हैं। तो मैं ये सब लोगों से ये रिक्वेस्ट करूंगा, आप लोगों से भी, कि जिंदगी में अगर आप खुश रहना चाहते हो तो इस ये जो जिस्म है इसको घोड़ा बनाओ, गधा मत रखो, और इस दिमाग को जो मंकी के जैसा काम करता है उसको अच्छा सर्वेंट बनाओ, आपका सर्वेंट बनाओ। तो इसीलिए आपको न सिर्फ योगा की जरूरत, योगिक एक्सरसाइजेस की जरूरत है, बट आपको मेडिटेशन की भी जरूरत है। और मेडिटेशन अब हैदराबाद में वर्ल्ड सेंटर मेडिटेशन का है, काना शांति वनम, और इट इज नॉट बेस्ड ऑन रिलीजन। इमेजिन दैट। एंड देन latest book has come called Spiritual Anatomy. It is available on Amazon. Please read it if you can. हर जबान में है, उर्दू में भी है, और वहां पे वर्ल्ड पार्लियामेंट ऑफ रिलीजन इस साल हुआ है, और it is so beautiful. So I advise you people also to do yogic exercises and meditation so that you improve your technology, you improve your skill, and then you become a very useful member of a society. No person is low or high, not because of money or knowledge, but what you contribute to your fellow human beings.
1974 में कोई भी ये देश में एक ट्रॉमा, फ्रैक्चर्स होते थे, एक्सीडेंट होते थे, लोग गिरते थे, हड्डियां टूटते थे, कहीं भी ये देश में एक हॉस्पिटल न रहा जहाँ पे इनका साइंटिफिक ट्रीटमेंट।
With care and compassion.
तो ये ट्रीटमेंट और वो जमाने में गवर्नमेंट हॉस्पिटल्स में, मैं उस्मानिया मेडिकल कॉलेज का स्टूडेंट हूँ, बाद में वारंगल में एमजीएम, वहाँ पे मैं ऑर्थोपेडिक्स किया है वारंगल में। तो जब हम देखते थे कि कीड़े रहते थे, मैगट्स पूरे बॉडी में, फ्रैक्चर्स वैसा आते थे विलेजेस से, सिटीज कॉर्नर से, पूरे हड्डियाँ रॉटन स्टेट में आते थे, सेप्टिक होके आते थे। एंड वो ज़माने में इतने अच्छे एंटीबायोटिक्स नहीं थे, अवेयरनेस नहीं था, खाना पीना नहीं था, हॉस्पिटल्स को आना तो दूर की बात है। तब डॉक्टर वेद प्रकाश ये महीने महीने ये हॉस्पिटल में रख के, इनका न्यूट्रिशन इम्प्रूव करके, मल्टीपल ऑपरेशंस करके, एक इंडस्ट्री में वर्क जैसा एक बिल्डिंग कंस्ट्रक्शन वर्कर है वापस उसमें जाए, एक एजुकेटेड पर्सन है उनके जॉब में जाए, एक एग्रीकल्चर लेबरर है वापस जाके उसका खोदना, करना, झाड़ डालना, वजन उठाना, ये सब कर चुके। इसको हम सैल्वेज सर्जरी बोलते हैं, मतलब लेट आए सो आड़े टेढ़े हो गए, हड्डियां चल नहीं सक रहा, बैठ नहीं सक रहा, उठा नहीं सक रहा, हाथ उठा के खाना मुंह को लेके नहीं जा सक रहा, ये फ्रैक्चर्स हम एक नहीं, दो नहीं, तीन नहीं, चार नहीं, हजारों में हॉस्पिटल्स में आते थे। तब ये डॉक्टर साहब ये काम शुरू किया। ये है हमारा फर्स्ट रिवॉल्यूशन। इट्स अनइमेजिनेबल, इट इज लाइक अवर ग्रीन रिवॉल्यूशन स्टार्टेड इन द 60s। जब अपने खाना नहीं था तो अपने गवर्नमेंट्स पूरा एग्रीकल्चर को इम्पोर्टेंस दे के, यू ऑल नो दैट, वैसा रिवॉल्यूशन था, ट्रॉमा रिवॉल्यूशन। अभी तो देश काफ़ी आगे बढ़ गया, डिस्ट्रिक्ट्स में हॉस्पिटल्स आ गए, अवेयरनेस आया, लोगों में पढ़े लिखे आया, खाना पीना आया, अभी सिचुएशन अलग है। सो दिस वाज द ट्रॉमा रिवॉल्यूशन। देन एज आई सेड, स्पाइन रिवॉल्यूशन, बच्चों के फ्रैक्चर्स, बच्चों के डिफॉर्मिटीज, बूनी अंडम, हंचबैक्स, ये टेढ़े हो गए सो स्पाइन्स को, बेबीज के, इसको पट्टियाँ डालना, ऑपरेशंस करना, ये 3, 4, 5, 6, 10 साल के बेबीज को उनके स्पाइन्स को स्ट्रेटन करना, ये सब हम कर चुके हैं। 1994 में फर्स्ट टाइम इन इंडिया छाती ओपन करके उसके स्पाइन को सेट करें, 1.5 साल की बच्ची को, आज बड़ी होके वो अभी सॉफ्टवेयर इंडस्ट्री में काम कर रही है। इतने छोटे बेबीज को, इट इज अनथिंकेबल इन 1994 that 1.5-year-old baby's chest can be opened in this hospital. And adult spine surgeries, fractures, deformities, infections, cancers, you name it, वो सब चल रहा। This is our second revolution. Third revolution ये है, the joint replacements हो रहे हैं, मगर complex hips हर कोई सर्जरी करता है, हर कोई क्रिकेट खेलता, बट वो टेस्ट प्लेयर नहीं बनता। तो टू गो टू दैट लेवल, दैट्स व्हाट डॉक्टर उदय प्रकाश हैज डन। ये खराब हो गए सो हिप्स, छोटे छोटे बच्चियां लंगड़ते चलने से, एक्सट्रीमली कॉम्प्लेक्स हिप्स, रूटीन हिप्स सब करते हैं, उनको करना। और अभी हम बताएं जो थोड़े जॉइंट को बदल के, इट्स ऑलमोस्ट लाइक ए डे प्रोसीजर, आज करे कल घर गए करके वो लोग अभी प्रेयर्स के लिए इंसान नीचे बैठ सक रहा, चल सक रहा, वॉक कर सक रहा। और अपने हैदराबादी में बोलना है तो 4 महीने का फिजियोथेरेपी करके वो ठीक हो जाए। So a sub is the third revolution. And of course, we have hand surgeons here. We have brachial plexus surgeons here. We have shoulder replacement surgeons here. We have foot and ankle surgeons here.
Tumor.
We have cancer tumor surgeons here of extremely talented, extremely ethical, extremely well trained doctors here. So अभी आप पूछें यही हमारे बच्चे हैं। गुरु को शिष्या यही चाहते।
एक चीज मैं बोलना चाहता हूँ, अभी तक आपने जो सुना वो ऑर्थोपेडिक्स का ही सुना है, मगर मुझे ये उम्मीद है कि ये हॉस्पिटल हर स्पेशलिटी के डॉक्टर हम लोगों के प्रिंसिपल अभी भी फॉलो करते हैं और वो इतना इम्प्रेस्ड है कि दे वांट टू सर्व दिस इंस्टीट्यूशन in spite of not getting the amount of money which they will get in other hospitals. हम पैसों के लिए काम नहीं करते, हमारे लिए जाने वाला पेशेंट स्माइल करते हुए गया, खुशी से गया, सेटिस्फाइड गया, तो वो हमारी वेल्थ है, हमारी वेल्थ है। पैसा कोई अपने दे के नहीं आता और न लेके जाएगा, सिर्फ अगर थोड़ा बहुत रहता है तो थोड़े दिन अपना नाम रहेगा, उसकी भी हमको ख्वाहिश नहीं।
ఈ రోజు మన ఉదయ్ ఆమ్ని హాస్పిటల్ 50 సంవత్సరాలు పూర్తి చేసినది. ఈ 50 సంవత్సరాలలో వేలాది లక్షలాది పేషెంట్స్ కు అతి ఉత్తమమైన వైద్య సదుపాయాలు ఈ హాస్పిటల్ అందించింది. ఈ రోజు కూడా మన దేశం నలుమూలల నుంచి, విదేశాల నుంచి పేషెంట్స్ వారి యొక్క ఆర్థోపెడిక్ జాయింట్ రీప్లేస్మెంట్స్ కానివ్వండి, ఫ్రాక్చర్స్ కానివ్వండి, స్పైన్ సర్జరీస్ కానివ్వండి, వందల వేల మంది వచ్చి ఈ హాస్పిటల్లో అతి ఉత్తమమైన వైద్య సదుపాయాలు పొందుతున్నారు. ఇది అంతా కూడా అతి తక్కువ ధరలో ఈ వైద్య సదుపాయాలు, అతి ఆధునికమైన పరికరాలను ఉపయోగించి మేము చేస్తున్నాం. ఇక ముందు కూడా పేషెంట్స్ యొక్క ఆరోగ్యాన్ని మా దృష్టిలో పెట్టుకొని ఎథికల్ ట్రీట్మెంట్స్, అవసరమైన ఆపరేషన్లే ఈ 50 సంవత్సరాలు మేము ఏ విధంగా చేశామో పూర్తి నిజాయితీతో కట్టుబడి, అదేవిధంగా ఈ హాస్పిటల్ కొన్ని దశాబ్దాలు, శతాబ్దాలు ఎన్ని రోజులు ఉంటుందో మాకు తెలియదు, చెప్పలేం. కానీ అత్యాధునికమైన వైద్య సదుపాయాలు, న్యాయంతో, ఎంత తక్కువ ఖర్చుతో వీలైతే అంత తక్కువ ఖర్చుతోటి స్పైన్ సర్జరీస్, జాయింట్ రీప్లేస్మెంట్ సర్జరీస్, ఫ్రాక్చర్స్ ఇవన్నీ కూడా మేము చేస్తామని మీ అందరికీ నేను తెలియజేస్తున్నాను.
My name is Dr. Uday Prakash. I'm a joint replacement and trauma surgeon. We are celebrating 50 years of Udai Omni Hospital that was set up by my father in 1974. The hospital is set on guiding principles of ethical practice, doing no harm to the patient and not doing operations unnecessarily. So over the last 50 years, we have become very popular with not only Hyderabad and Secunderabad, but also the rest of the country and also from around the world. We now have patients coming from East Africa, from Middle East, from Southeast Asia, from many Indian families, from US, Canada, UK, have come to us for our opinions and surgeries. So this hospital has a long legacy of treating trauma, complex surgery, revision trauma surgery, revision joint replacement surgery, complex spine surgeries, spine deformity surgeries, bone tumor surgeries, pediatric orthopedics, hand surgery, microsurgery. Now, we have excelled in all aspects of orthopedics, and that is why we have stood the test of time, and we are still here after 50 years and thriving. Thank you for all of you being here. It's been a pleasure.